everything. Oh well. Okay, let me go get this disclaimer real quick. Hmm. Of course. Oh my gosh. It never fails. This thing acts up every single time. Every time. Such Here we go. Okay. So I'm sweating like a Russian racehorse. Oh, I don't even know if I can go. I guess I could put it here. Brandon. Hi, Brandon. Okay, well, I've got a visitor. I guess I'll go ahead and get started. I won't wait. Hi, Brandon. Thank you for coming. All right. Well, I'm going to go ahead and get started on time because I hope you can hear me. Will you put a thumbs up if you can hear me in the chat, please? Because my air went out, so I'm going to be sweating like a Russian racehorse. Hi. Hey. Okay, great. Hello, you guys. Thank you so much. I am super excited. And I got to tell you guys, I worked all day. I've worked like 11 days in a row. And I got off work today. I came in the house. It was almost 90 degrees in my house. And I said, you know what? So if I'm sweating, just kind of go with me here. It's hot in here. But thank you guys so, so much for coming. And I'm not going to try to put up a front like I don't have a teleprompter over here. I do, because what I'm presenting today is some important information. But before I even go into all of that, I just want to say, I wanted to do this for my friends and families, or friends and family that are caregivers, because, we don't want to wait to prepare for an emergency when the emergency is actually happening, right? The goal is to be prepared. So I'm going to talk about a few things tonight, but I don't want anybody to get overwhelmed and think, oh my gosh, I don't have that. Oh my gosh, I don't have this. Because what I do is as I go shopping, I'm looking for stuff. And I'll kind of talk about that as we go on. I'm not going to keep you guys long. This really should not last more than 30 minutes. When I timed it and went through it myself, of course, it's always faster. I don't know if you can remember when you were in school and you had to do a speech class and they were like, oh, it's got to be 15 minutes. And you're stressing out going, am I going to be able to get 15 minutes? And then you start reading and going over, and before you know it, you're done in 5 minutes. So this won't take very long, but certainly if you guys have any questions, feel free to put that in the chat. I do have a giveaway for whoever stays on towards the end. It's just a little something. It's nothing major, but I like to give gifts because I like to receive gifts. So with that being said, let's go ahead and get started. So thank you so much for coming to the ABCs of Caregiving. So tonight we're talking about eating. And there is a bonus tonight. We're going to be talking about the emergency go-bag. So my name is Demita, and today we're talking about the letter E. We're going to talk about some practical things when it comes to caregiving, the things that we should be paying attention to as far as eating and drinking. But don't go anywhere when we finish with that, because I am going to go over the emergency bag. I'm going to open my bag and show you guys some of the things that I kind of have in my bag. Now, keep in mind, I'm ex-military and so is my daughter. So we go a little hard on some of the stuff because we've been in the military, but you don't have to have all the things that we have. These are simply suggestions. Okay. So I'll show you some of the things that I have in there, and then we will go over that. So I do want to read this important disclaimer. Before we begin, I want to make it very clear that this is for general educational and informational purposes only. Nothing I share today should be considered individualized medical, nursing, nutritional, emergency management, legal, or professional services. Every person is different, and medical conditions, medications, dietary requirements, swallowing abilities, mobility needs, equipment needs vary from person to person. So just keep that in mind. Just follow whatever the individual plan of care is for that individual, from their physician, their registered dietitian, their speech language pathologist, pharmacist, or other qualified health professionals as applicable. Okay. So during an emergency, follow the instructions of 911, emergency responders, and your local emergency management authorities. Never delay emergency assistance because of information shared on this program. That is not the intent. This is for informational and educational purposes only. Okay. And do you guys see that going across the bottom of the screen? It should be going across the bottom of the screen, that disclaimer. Do you guys see that? It should be on there. If not, I definitely will put it in the comments. Okay. So we're going to talk about eating. So eating sounds very simple, but when you're caring for another person, mealtime can tell you a lot. As caregivers, we're not only asking, did they eat? We're paying attention to, has their appetite changed? Are they losing any weight? Are they having any difficulty swallowing? Are they drinking? Are they eating less? Are they coughing or appearing uncomfortable when they're eating or drinking? And has their weight changed unexpectedly? So, can they feed themselves, or do we now have to feed them? Do we have to cut the food up? Do we have to moisten it? Pay attention to all those things. Does texture bother them? Do they no longer want meat? All those things matter. So, take notes of that. Now, are there any medical medications or medical conditions, established dietary guidelines that would affect how they eat? And remember, people do have a right to say they don't want anything to eat. And I do run into that a lot in my career, that families will say, well, gosh, they need to eat, they need to eat, they need to eat. But people have a right to say, I don't want it. And if they don't want it, we don't want to force that, because forcing someone to eat can cause them to aspirate. And when I say aspirate, that means that it goes into their lungs. That can cause pneumonia and a whole cascade of things. So generally speaking, if someone says they don't want to eat, we allow them to have that choice. That's their right not to eat. Okay. So just kind of keep that in mind. Our job as caregivers isn't necessarily to diagnose why something has changed. Our job is to observe and document when appropriate, and communicate concerns to the appropriate healthcare professionals. So we're going to talk about mealtime and dignity now. Remember something we've already talked about in this series: D for dignity. And dignity belongs at the dinner table too. So, whenever possible, allow the person you're caring for to participate in the decision of their meals. And that's kind of what I just mentioned. You want to give them the adequate time and avoid rushing them, because rushing them can also cause them to choke. Create a comfortable environment and encourage as much safe independence and their ability to follow the plan of care as possible. Food is more than nutrition. Food can be comfort, food can be culture, food can bring back memories, and mealtime can be an opportunity for companionship. Sometimes sitting with someone, talking to them, and making mealtime enjoyable can make a difference. I'm probably dating myself here, but back in the day, we would sit down at the table. We actually would sit down at the table and eat like, a family. These days, everybody's in such a hurry. They're on this phone and they're doing that, they're doing that. I miss that, and if we could just get back to that, I think it would be very beneficial for all of those involved. So mealtime can be very important. That can be a bonding time to kind of talk about the day, kind of catch up on, what's to come, just kind of talk about what's happened during the day. Because, we process a lot of things, just traveling back and forth to work, dealing with different personalities, the news, et cetera, et cetera. So sometimes just sitting at the dinner table with the family, just simply talking and just being there can make a big difference. So keep that in mind. Try not to rush that. So notice any changes. One of the most valuable things a caregiver can do is simply to notice things that are different. Maybe mom normally finishes breakfast and suddenly she doesn't want her breakfast. Maybe dad normally drinks throughout the day and now you notice he's drinking much less. These observations matter. You don't have to determine the cause yourself. You can simply say, I've noticed a change and I think we need to let an appropriate healthcare professional know. That's caregiving. So now we're going to talk about swallowing and choking awareness. I want to spend a moment talking about swallowing and choking. This is especially important to me because I am a CPR and first aid instructor. Difficulty swallowing and actually is an actual choking emergency. I'm sorry, let me rephrase that. Good thing I can edit this. But difficulty swallowing and an actual choking emergency are not necessarily the same thing. If someone develops a new difficulty chewing or swallowing, frequently coughs while eating or drinking, holds food in their mouth, which is called pocketing, or otherwise appears to have difficulty swallowing, don't simply guess at a solution. Contact the appropriate healthcare professional for individualized evaluations and recommendations. Don't independently change someone's food or liquid consistency unless that's consistent, individualized, established plan of care that you've received from an appropriate professional. So let's talk about choking. If a person can cough effectively, encourage them to continue coughing while monitoring them closely. But a severe airway obstruction is an emergency, you guys. That's an emergency. And I think we've all seen that standard where they're choking. They say, oh, if they're grabbing their throat, intervene, because that means that they're having trouble. Their airway could be blocked, and we need to take that as an emergency. So the current American Heart Association guidance for a responsive adult with child with a severe airway obstruction calls for 5 back blows and 5 abdominal thrusts, repeating as indicated until the object is expelled or the person becomes unresponsive. So I don't want to just sit here and talk. I want to involve my audience. So has anybody seen Mrs. Doubtfire? I'm certainly not trying to make light of someone choking, but has anyone in the chat seen Mrs. Doubtfire before with Robin Williams? God rest his soul. Okay, great. So yeah, that was a classic situation of someone choking. And I have experienced that as a registered nurse. And, it scared me. But, that old saying that a mom can lift a car if her child is in distress. I mean, this gentleman, without disclosing any HIPAA information, this gentleman was probably 1.5 times my size. True story, I swear. And we were eating. I was a team lead on a psychiatric unit. So he was a schizophrenic patient, but he started choking and he coughed a little bit first. Then he did this, the classic thing, like in Mrs. Doubtfire. And I jumped up because I'm the charge nurse, right? And I ran over and I did the abdominal thrust. And sure enough, it flew out just like on Mrs. Doubtfire. That was an experience that I'll never forget for the rest of my life. That's a true story. And it meant so much to me because the expression on his face when that food actually popped out it just meant everything to me. It meant the world to me. So the point here is why I paused a little bit, you guys, because, saving someone's life, that's a big deal. And that can happen to any one of us. You can be in a restaurant. I can be in a restaurant tomorrow and we see someone start to choking. So the main thing is to do something. But unfortunately, what happens in a lot of situations is we get that bystander freeze. People freeze because they're waiting on somebody else to do something. Well, I'm that somebody else. We're that somebody else. So doing something can literally change someone's life. Okay, so I won't beat that drum anymore, but I just thought of Mrs. Doubtfire when I thought of them talking about this, and that is classic. They will cough, then they'll choke, and then they'll grab at their throat. So they're choking. All right. So 5 back blows or 5 abdominal thrusts, repeating as indicated until the object is expelled or the person becomes unresponsive. And we'll get into some more things about, I'll do some first aid and CPR stuff later. But an infant requires a different technique. Current American Heart Association guidance for infants uses 5 back blows followed by 5 chest thrusts. This is exactly why the proper hands-on training matters. So even though I'm a CPR and first aid instructor, this video is not a substitute for being certified CPR and first aid course by an individualized professional with instruction, because you have to test. There's a written test and you have to demonstrate. So this is not in place of that. This is just informational and educational. So please sign up for a class if you're not CPR or first aid certified, because it is something that any one of us could need at any given time. So preparation is only what we put inside of the bag. And I'm sharing this with you today because I want caregivers to understand something very important, that preparation isn't only what we put inside the bag. Preparation is also knowing what to do when someone depends on us. If you're a caregiver and you haven't had CPR first aid training, I encourage you to become professionally trained. Okay, so we're going to talk about food safety. We also need to think about food safety. This means things like keeping hands and food preparation areas clean, keeping food appropriately separated during preparation, and keeping foods appropriately make sure you wash your hands and properly storing foods that require refrigeration. Older adults and individuals with certain health conditions may be particularly vulnerable to complications from foodborne illnesses. So, food safety is a part of caregiving too. So, I'm going to recap the eating portion of that. So, when we say E is for eating, I want you to remember four things: observe, encourage, respect, and communicate. Pay attention to the changes, respect the person's dignity, encourage appropriately. And when something doesn't seem right, communicate with the appropriate healthcare professional rather than trying to diagnose or treat the problem yourself. We cannot diagnose. If you are not a physician, you cannot diagnose. I certainly can't. That's outside of my scope of practice. So that's why I'm saying that this is educational and informational only. Make sure that they reach out to a physician. And if you can't handle the problem, call 911 immediately. Okay, so now this is the bonus. We're going to talk about the emergency kit. And as you can see, I've got it here behind me on the couch. I tried to organize it as best I could, but we're going to talk about a few things. Okay, so this is the part two when I'm going to open the bag, and I want to say something very important. I'm going to mention that throughout this broadcast because I don't want anybody to come in midway and think, oh, yeah, she's trying to tell us to do that. No, this is for education only. So I don't want anybody watching this to feel overwhelmed. I said that in the beginning, but I'm going to repeat it because I am going to show you quite a few things. But as I said before, I served in the Air Force. My daughter served in the Navy. So we kind of over prepare. So don't feel obligated to go out and buy anything. As a matter of fact, a lot of this stuff you may already have at home. Some of it you may feel like you don't need, and that's okay because it's all individualized based on, what your family needs, the person you're caring for needs, what you need in regard to medications, so forth, and etc. Okay, so you do not need to run out tonight and purchase everything that I'm going to show you. I'm just going to show you some examples. Okay. But if you want to jot some things down, or certainly if you would like for me, and again, I'm not getting paid. This is not endorsed by anybody, by Walmart, by YouTube. I'm not getting a penny for this. I'm doing this on my free time because I care about people. I love what I do. And, as a nurse, I'm always educating. I'm always advocating for my patient and family. So it's something I do all the time. And I like to share information. I like for people to share information with me because I don't know everything. So I'm going to be showing you these things. If you want me to send you a list of some of the things I purchased, I'll be more than happy to do that. But again, nobody's paying me for this. They didn't donate anything. I bought all these things myself, or my daughter did, because she helps out a lot. Okay. So what I am showing you tonight is not a universal bag for every person or every type of emergency. We all know. As a matter of fact, I'm not one, when I go to meetings, I don't like for anybody to just sit up and talk. Nobody wants to hear that. So I would like for somebody in the chat to tell me what kind of emergencies. Just throw some stuff at me because we've got several kinds of different emergencies. Can somebody tell me a type of emergency that we might have to have a to-go bag for? Exactly, fire. And that's a big one. Tornado. Yes, ma'am. I'm in Texas. I don't know where everybody is. Is anybody else in Texas? I know Brandon's in Florida. Flood. Yep, absolutely. Absolutely. Yep. So there's all kinds of emergencies. There's no way I'm going to tell you that this is going to be conclusive and cover every single detail about every emergency. Again, this is just to give you a general idea, because if you don't have a to-go bag, just think about it the next time you go out. If you don't have a flashlight, purchase one. If you don't have batteries, purchase those. And I'm going to show you some of the things that I have here. But yeah, those are three, but there's many more, but those are some good ones. In Texas, we get floods all the time. We get tornadoes. So those are very popular here. And it's so dry here in the summertime that we are at an increased risk most summers for fire because it's so dry and we don't get a whole lot of rain. And oh, by the way, this is my double office here, you guys. This is my bookcase. You get a glimpse of both of my offices here. I couldn't figure out how else to put my laptop, but I'm a real person, and I also wanted you guys to see that I'm not trying to put up a front. I'm just a real person that cares about people. So this is me. This is my home. This is my office. Okay. So we'll go over the to go bag here. So there are several kinds of emergencies. All right. So your to go bag may not look anything like mine, and that's okay because the person you're caring for may have completely different needs. All right. So, and always remember this: people first, go bag second. But that's another reason why I wanted to go over this, because if we already have it prepared and we already know it's in that front closet, if we got to get in there in 5 minutes, boom, all we got to do is grab our loved one, hit that bag on the way out the door, and we're out. But if we don't have that bag and we only have 5 minutes, we're going to be scattered trying, do I get this? What do I need? And that's where it can be stressful. So the point of this is not to stress anybody out, although I was a little anxious getting everything together. But the point is not to stress anybody out. Seriously, just look at what you have, take notes. And again, if you want me to send you a list of anything that I have here, I'll be more than happy to do that. So let's not delay any further. Let's go over. But people first. I wanted to say that people first, go bag second. And again, I already talked about that the bag is most important, people next. Different emergencies require different responses. And sometimes emergency officials have to tell you to leave right away. Other situations may require that you remain where you are or immediately go to a designated safe location. Follow instructions of the emergency responders and your local authorities. Never delay getting yourself or another person to safety because you are trying to get a bag or belongings. Leave that bag there. Get your baby, get the person you're caring for, that elderly adult. You take care of the people first. It's always people first. Same thing they tell you when you fly, you guys. I'm sure everybody here has been on an airplane before, and they always say, take care of yourself first. Same thing. Leave that bag if you have to. But again, if you have one and you can just grab it on the way out the door, great. Okay. All right. So remember, people first, bag second, always. So now we're going to open the bag. Okay. So I'm going to get up. I'm going to move this chair out of the way. So the first thing I want to show you, I'm going to start with this little bag over here. So if you have pets, and we do, we have a rescue. We lost one back in May. But if you have pets, you want to have a little to go back for them. This is her little allergy medicine because our dog has allergies. Some little snacks for her, and just a little can of food. And I'm just showing y'all examples, okay? So that's her food. As far as food for people, you can have something like this, some protein drinks. Always, always, always look at the expiration date on anything. And if you're putting food in these to-go bags, I wouldn't put something like this in the garage because it's really hot here. So I have a to-go bag with food that stays in the house. Then I have a to-go bag with the stuff that I don't have to worry about it getting too hot and spoiling, or like batteries. I don't put those in the garage because we're in Texas and it's been like 115 degrees here. So I don't do that. So I have two separate bags. So with this, you can put like some protein drinks in there, put some little containers. So if you just got to get out quick, you got something to put your food in. And you can buy canned goods that are easily opened like this. Again, make sure you look at the expiration date on everything. And I would check these at least every 90 days to 6 months, especially if it's food, because you want to make sure that it hasn't gone bad. Just check it, But you can get the ones with the easy top. These are a little more expensive unless you get the generic. This isn't generic, but they have some generic ones. It's the same food. You can get it with this or take a can opener with your food. Some little Fruit Loops if you have kiddos. And also, since we're talking about the kiddos, if you do have kiddos, if they have to leave the house, kids and dogs and pets, everybody gets a little anxiety if we got to, do stuff fast. So take them something that they can play with, like some bubbles or something like that. So little Fruit Loops. You got these little powder drinks that don't take up a lot of space. You can take those with your water. They say 1 gallon of water per person. 1 gallon of water per person takes 7 days worth, is what they say. That's the recommended amount, okay? And like I said, you can get this little generic water from Sam's, Walmart, but you can get these this even has fiber in it, and it's got a little probiotic in it. They don't take up as much space. Some people don't like to drink water. I love water, thanks to my big sister. We used to always drink water, so I'm still a lover of water. I still drink a lot of water, and we should all be drinking about 8 glasses a day. But you can buy these handy little with grape or benefiber or whatever. The benefiber helps if they have issues with constipation. And again, check with your medical professional. Make sure this is something that they can take. But that's something you can put in there for the food. You can get some little packs of peanuts, little cookies. These are complex carbohydrates. Just some little things you can put in your to-go bag. So that's for food. Okay. And these are just more bubbles for the kids. I like bubbles too. Okay. Now, everybody's in this age of technology, you guys, but what if we get somewhere and our phone doesn't work? Or, and we have these. We have this solar powered charger, and it's got a little flashlight on it. But it'll charge your phone, little flashlight. So you really want to get things that have multi-purpose. So this is solar powered. We can lay our phone on it and charge it, and then it's got a little flashlight on it. But if you don't have this, the solar power one, which again, don't go out and buy it. That's not what I'm suggesting. If you don't have this, though, make sure you have a little paper map. You can get these for like at travel stores, they're free usually. I had to buy this one because I was trying to get, at the last minute, I didn't have this. And I wanted to show you guys, just put it in there just in case. But this is a little paper map. I think this one was $6, but you can get them free at the little rest stops and stuff like that. And again, you want to get something that's this is a little lamp, but it also has different colors. It's got red and green. And well, of course, I knew I wouldn't be able to find the green today. Demi did it yesterday, but this is a little lantern just in case. If you have someone that has you guys may not have these, so don't get mad at me now. But these are just some little things I bought when I was in nursing school. It tells you about if somebody has seizures or if they're diabetic, what you can do if they have low blood sugar, high blood sugar. You can get these off of Amazon. Nobody sponsored me. I'm not getting paid to say that. But you can get these off of Amazon, and it just tells you what to do in the emergency, in the case that somebody's having an emergency. If they're diabetic, you want to have some glucose tabs or something like that. If you got to leave quick, that's something else you would want to put in your food bag. And again, check with the medical professional. I'm not a doctor. I'm just saying, check with their medical professional to see what they would recommend putting in their emergency bag. But these are just something that I have from nursing school. Always take a little notepad and a pen to take notes. Okay. You want to write notes just in case you got to write something down, because again, if your battery goes dead, you need to be able to take notes. Now I have this. It's a little glow in the dark little mace thingy, just in case, because I can't talk about, weapons or anything like that. And I'm not going to, but, just in case you need to protect yourself, this is just a little thing of mace I have, and it glows in the dark. So multi-purpose, everything that I get, I try to make sure that it's at least, it can be used for one or two things. Okay. Let's see. Oh, these are just some little utensils, and this is some more stuff, first aid. This is another look. They have several different kinds of first aid kits. This is a cute little one that I got, and it's got stuff in here for wound care. If you have someone that has wounds, you want to, always make sure that you try to keep those clean. This one wasn't super expensive, and it's kind of cute and handy and easily visible. It's orange, but it's got stuff in here for wounds. It's got some Band-Aids, stuff if you get stung by a bee, Silvadine for wounds, cotton swabs, safety pins, all the basic little things that you would need in a first aid kit. So first aid kit is something you definitely want to have in your to-go kit. So you can get little ones. This is a little one, or you can get, this one is a 2-person one. And I thought it was pretty cool because it's got a lot of stuff in it, some hand warmers, foot warmers. It's got some flares, a whistle. I know you guys remember the whistle from Titanic, but just in case, it's got some masks in here, gloves, hand sanitizer, but this is a 2-person, and I think this one was like $30. If you don't want to get all the individual stuff, which you can go to Dollar General, Family Dollar, and I mean, they have them literally for $1.25. It doesn't have the same stuff in it, but you can literally put a first aid kit together for cheaper than $35. Or if you just want to get it and know that you've got it. And again, always check the expiration date, and it has All the ingredients here, what's in it, you see this one doesn't expire until January of 2028. So I'm good to go on this one. But I just wanted to show you another example. This is just another thing that we put our food in. So a big one, and of course I just wrote some generic stuff on here, but this is a fireproof container, fireproof, because I didn't address everything specifically, but this is fireproof. So my papers, you want to put insurance papers in there. You want to put your medical power of attorney, any school loan paperwork, anything that's important to you that you can't afford to lose. And take pictures of like your driver's license, birth certificate, social security card. Take pictures of that and put it in something like that, so that God forbid, in an emergency, you've got all those documents in one place. Because I don't know if anybody else has ever misplaced their wallet or lost it or whatever. If you don't have pictures of what's on the front and back of that, as far as the numbers and all that, it's hard to remember all that. I don't know about you, but it is for me. So take a picture of that. Make sure you keep all that in a safe place. But medical power of attorney, any advance directives, like what you would want done if in the event that, God forbid, your heart stopped, if you want CPR or not. Those are important documents to have also. If you don't have those, you might want to think about getting those in place. Okay. Insurance paperwork, ID. We talked about that. And then on that note, I'm going to go ahead and talk about medications. This is not it. But this is just some Salon Pas cream that you can put on if you're having pain. This is hydrocortisone cream if you're for itching, like bee stings, or poison ivy if you're outside. Just FYI, I'm just showing you guys stuff. You don't have to go and buy all this stuff. These are just some things that we have in ours. And medications, you want to have a list of all of their medications, the person that you're caring for, because if you have to leave, you want to do that now. You definitely don't want to wait for the emergency to write down all of their medications. Most people already have that. They write them down. And what I usually recommend when I go see people is I say, write them down and take a picture of it, put it on your phone. I know we talked about the battery going dead on the phone, but if you've got them written down and you take a picture, then you kind of got to back up. Okay, so let me see. Let me make sure I didn't miss anything. I'm using my teleprompter. Okay. So does anybody have any questions about anything so far? As far as the medication list is concerned, you want to make sure that you have the name of the medication, the dose, the schedule, any known allergies. That's super important. And any pharmacy information and important healthcare contact information, whoever their doctor is, their pharmacist. If they see, if they have an oncologist or whomever their team of people is, you want to have all those written down. So for actual medications, follow the person's prescribed regimen and applicable storage instructions, because some medications have to be refrigerated. So you want to make sure that you follow that. Okay. Do not change doses, do not discontinue medications or substitute medications based on anything discussed in this video. I'm just advising that you want to, make sure you have a list of your medications, the allergies, the dose, etc. Have all of that listed on a piece of paper or somewhere in a safe place. So God forbid, if there's an emergency and you need to leave, you'll have all of that. Because some people take quite a few medications. So to have them, listed, then that just, it's just good to have it. All right. And also you want to have their emergency contact information. Okay. And that's where we go back to that little pad of paper. You want to write that down. Okay. Let me see. Somebody said something in the chat here. It says, send the list to yourself in an email. That's a wonderful idea. It says, send the list to yourself in an email so that if something happens to your phone, you can check your email on another device and get that list. That is wonderful. I'm so glad you said that, my friend Hill. And I want to piggyback on that and say, I was with a family and they were telling me that what they did is, I know everybody's got their own emails, right? But they had one email address set up that everybody in the family had, and they sent all their important, like if I get my insurance policy and my beneficiaries, we just have one email address that we send it to instead of it just being in my email. And all of our important, like real important, like the medical power of attorney, the power of attorney, the insurance paperwork, that kind of stuff, they send it all to one email. So all the sons, daughters, everybody had that one email, and that's where everything went to. I thought that was a really cool idea. That way, there's no question. Of course, I have a book that I keep on my papers. My daughter's really good about that. She bought me a where she wants me to keep everything. So my do not resuscitate paperwork is in there, and all my documents. So she knows exactly what I want to happen when the Lord calls me home. But yeah, they had just had one email address that they sent everything to, and that way everybody knew where everything was, and everybody had the password, so there was no fumbling around, when they needed it. So thank you so much. So yeah, this kind of piggybacks on what you said, Hill. It says because technology isn't guaranteed and to be available in every emergency. So, like I said, that solar powered charger or something along those lines would be good to have. So, depending on the individual, consider appropriately protected copies of things such as emergency contacts, healthcare provider information, important medical conditions, that emergency personnel may need to know. Like, for example, I know you guys have seen those bracelets. I think those are really cool. Like for people that have diabetes or they have seizures or, they've had a mastectomy on the right side and they can't have blood pressures on that side. Things like that are important just to have in a safe place or just even, to have them wear. And now that I'm thinking about that, I want to speak just a little bit about a life alert. They have so many cool things. And again, I'm not being sponsored by Amazon. I'm not being paid by anything, but I just know that that's where you can get them. They have these cool little watches that they can get that have like little life alert things on, and they're not super expensive. And a lot of families use those, in case, grandma or Aunt Sylvia or somebody is at home by themselves and God forbid they fall or something, then they can just push it on their watch to let. So, because sometimes they might forget to put that, the life alert that they used to have. They might, I don't know. And I'm not, there's just options, is all I'm saying. There's options for the watch, there's options for this, things that they can get in case there's an emergency. Okay, so we're getting through this pretty good, you guys. So allergies, insurance information, identification information, and relevant medical or legal documents when appropriate. Protect sensitive information carefully. Okay, and never post private or medical identifying information publicly. Never. Okay, so we're going to talk about DME equipment and assistive devices. So DME means durable medical equipment. And that could be a walker, it could be a cane, it could be a shower chair, a wheelchair, a bedside commode. Those are all, a hospital bed. Those are all considered durable medical equipment. And we wouldn't be putting that in an emergency bag, but it is part of planning, because if someone needs a walker to get up, you'll need that walker to get them out of the house. So obviously everything everyone uses, they're not going to be able to take, but this is part of the planning. Ask yourself, what does the person I'm caring for need? What do they depend on every day? Depending on that individual, that might include, as we said, a walker, a cane, a wheelchair, prescribed respiratory equipment like inhalers or nebulizers, BiPAP, CPAP, things like that. Respiratory, BiPAP, CPAP, hearing aids, glasses, and you want to take an extra set of glasses in your to-go bag as well. Diabetes related supplies, feeding equipment, ostomy supplies, catheter supplies. And like I said, all this stuff doesn't apply to everybody. This is just a general list, you guys. Wound care supplies. Sometimes you can get a first aid kit with that in there. Incontinence supplies and such. For young women, they may need sanitary napkins. Elderly people may need Depends pads or things like that. You want to have those available as well. Okay. All right. Sorry, I pushed the wrong button, lost my place. But that's okay. We'll just keep going. Okay. So, um, sorry, you guys. Lost my spot. Okay. All righty. Okay. Any questions about anything? We'll do the drawing here in just a minute. We're about really like just a couple minutes away with getting this done. Okay. All right. Okay. There we go. I think we. Okay. So we were talking about. I'm sorry. You got okay. Back. Here we go. Okay. So yeah, not everyone is going to need those things. The point is to identify the person's essential needs before an emergency happens. If someone's equipment depends on electricity, batteries, or another specialized source, speak with the equipment supplier and appropriate healthcare professional about emergency backup planning. Okay. So backup power. And that brings me to something that obviously isn't going inside of my bag. I don't know how many people have a generator. Does anybody here have a generator? I keep saying I'm going to get one. I'll admit I don't have one. I need to get one this year though. Because luckily though, if you live close to a hospital, like knock on wood, but if you live close to a hospital, we don't, I think I've only lost power one time in the 20 some years I've been in this house. But if you don't, having a generator is a good thing. So, yeah, you might want to think about having a generator. Okay. So, what happens to the person I'm caring for if our normal power source isn't available? Not yet. Yeah, I don't have one either. Okay. If someone depends on electrically powered medical or assisted equipment, develop an emergency backup plan ahead of time. That may mean talking with the person's healthcare professional, medical equipment supplier, utility provider, or local emergency resources about appropriate options. Depending on the equipment, appropriate backup batteries or other backup power arrangements may be part of the plan. Some households may also include portable backup equipment as part of their broader emergency planning. Whatever backup power option you consider, follow manufacturer instructions and current government and local safety guidelines. And don't forget about medication. If a medication requires refrigeration or special storage, ask the pharmacist ahead of time what should happen if normal refrigeration isn't available. So I'm going to stop right there and show you guys something else we did as part of our kit. Now you can get these handy dandy. This is a little one, but you can get these little ones to put your medication in. Put this as part of your to-go bag. This is a little one, but you can get different size ones. And also, you may even have one of these little 5-gallon buckets in the garage. You can put your first aid kit. You can pack some stuff in here. So you don't have to go out and buy stuff, right? And the other thing I want to show you is if you have someone that is wheelchair bound, they may not be able to carry the to-go bag. You can find this little ladder. I'm sorry, not ladder, but wagon. And it just folds up. It folds up like that. And then you just open it. So they can throw their stuff in here and then head on out the door and pull it out the door if they can't carry it. Okay? All right. So, personal care needs. So, you want to have a change of clothes in there. And that's why I said check your bag every 60 days, 90 days. And you want to make sure if it's winter, you want to have some long sleeve clothes in there. If it's summer, obviously, well, you might still want to take one set of long sleeve clothes because you never know, just to be safe, one set. But if it's summer, you want to pack, summer clothes because it's like 115 degrees here. So you wouldn't need long sleeve shirts. But the personal care items. So depending on the individual, that could include a change of clothing, undergarments, hygiene supplies, personal cleansing wipes, denture supplies, incontinence supplies, appropriate protective supplies, and other personal items that they regularly require. So remember, individualize your bag, okay? So food and hydration. If you have to leave home with someone you're caring for, think about the person's established dietary and hydration needs. Do they have food allergies? Do they follow the established therapeutic and prescribed diet? Do they have special feeding needs? Are there foods or liquids that they have to avoid? Do they normally use a particular nutrition product? Don't assume that whatever food happens to be available will necessarily meet that person's individual needs. If specialized nutrition or swallowing considerations are involved, plan ahead with the appropriate healthcare professionals. So communication. Next is communication. Depending on the circumstances, consider your phone, charging cables, a portable power bank, written emergency contacts, and communication aids when needed. Small notebook and pen. We already talked about that. If the person you're caring for has difficulty communicating, think ahead. How will the emergency personnel know what this person needs if they're unable to communicate it? That's another reason written information can be so valuable. Comfort and individual needs. Here's something easy to overlook: comfort. For some people, unexpected changes unexpected changes in surroundings or routine can be particularly stressful. Okay, so depending on the person you're caring for, consider whether this is an appropriate, whether this is appropriate, familiar, or comforting item that they might need that might help. For example, some Alzheimer's and dementia patients like little doll babies to hold on to. It just takes them back to when they had little kids. So if they like to hold that down and that gives them comfort, you want to put that in the emergency bag as well, if that's something they're familiar with. Maybe it's something else that's meaningful to that individual, like a picture of a loved one that they've recently lost. We're not trying to pack the entire house, but sometimes that one picture or that one bear can make all the difference in the world. We're remembering to care for the person that we care for if we have an event. Okay, so this is where I want to stop for a second because preparedness can start to feel a little overwhelming. You're probably sitting there thinking, Demita, what in the world are you doing? Nobody has all that. Who's going to the store to buy all that? Well, you don't have to, and I don't want you to. I was just showing you some examples. This isn't a competition. You don't have to build everything tonight. Ask yourself, what would the person I'm responsible for absolutely need if we had to leave? That's really the most important question in everything we've talked about. What would we need that we could not do without if we had to leave right now? Okay. So maybe tonight, just start with the medication list. Write all the medications down, the allergies, the prescription, how many they need to take, when they take it, and make sure they have enough. Make sure that they have enough, at least for 2 weeks. Um, so start there. If you don't have anything else in place, don't get overwhelmed. Just do a little bit at a time. And like I do, when I go to stores, I go look at the clearance aisle, see what they have. You'd be surprised what you can find in the clearance aisle. Before you know it, your bag will be full. You probably have Band-Aids and cotton balls and some alcohol in the cabinet in there. So you can start right there. That's a good start. All right. So this weekend, you can start on your bag. Preparation can happen one step at a time. And you know what I always say? A mustard seed is all you need. Just start with one seed. So, I'm not gonna, if someone says that they want a copy of that FEMA list, I'll be more than happy to provide that. But I don't think I'm gonna go into that. I think this has been enough. I didn't realize this was gonna be almost an hour. I appreciate you guys for hanging in there with me. So I'm gonna swing over here. Let me see. We got Brandon, Lady Boss, Sweet Tea. I got Tea. Okay. Oh, hold on. Can you guys see the wheel? I gotta take a name off of here. Hold on. I gotta. Oh, well, Tina won that one, but I gotta put some more. Hold on. Okay, you guys. Let me put Brandon. Okay, Salty Sailor. Yeah, we're almost done, you guys. I'm going to do the drawing now. Salty Sailor. Who else do I have? I want to make sure I don't miss anybody. Let's see. I got Brandon, Lady Boss, Nandy, Nandy TV. Okay. Okay, 1, 2, 3, 4, 5. I think I got 5. I think make sure I got everybody. 1, 2. Okay, I think I got everybody. Okay, so here we go. I'm gonna spin the wheel, and then you can just inbox me your information, and I will go ahead and get the prize sent to you. So let me get over here. All right, here we go. Spinning the wheel, and the winner is Hill. Can you guys see that? Did you guys see that? Or did I forget to add it? Oh no, did I forget to add it? Oh, I didn't add it. Shoot, at the stage. Okay. Let me do it again. Okay, let me do it again. So I'll give away 2 gifts because I messed up. Okay, wait. Okay. Okay. So I'm going to spin now. Here we go. Okay, so we're gonna spin again. Okay, spin. Oh, did it not? Can you? Can y'all see it? Can't see it. I'm gonna spin it again. Okay, Nandy, one. I will spin again. Okay, so one. There will be 2 winners. Okay. Mhm. Why is it? Oh, okay, wait. Okay, there we go. Huh? Why is it not letting me spin it again? Oh, sorry, y'all. I don't know what it's doing here. Oh, wait. I gotta go here. Okay. There we go. Okay. Okay. Why is it not letting me spin it again? Shoot. There we go. Oh, no. Oh, no. Oh, no. I think I was. Oh, no. Okay, wait. Can y'all still hear me? Okay, wait. Let me spin it again. I don't know why I did. I think I'm supposed to remove the name once I spin, y'all. But Nandy definitely won. Let me spin it again. I think I gotta. So let me do this. Okay, so there we go. Okay, there we go. Now, okay. Wait. Oh shoot. Okay, there we go. Yay! Hmm. Oh, you can't see it. Well, it's supposed to be. Oh, well, it was supposed to be on there. Oh, okay. Okay. Okay, so we got 3 winners. Did anybody else have any other questions about anything? That's everything, you guys. I do want to close out though. So that was the surprise. It's a starter kit, a first aid starter kit. But since I messed up, I'm actually done now. So I'm going to go ahead and close out. But I got to read my little disclaimer here. So it's a small starter kit. That's what the prize is. It's not a complete emergency kit. It's not any medical equipment. And it is not intended to meet any individual emergency needs. Participation was free. There's no purchase necessary. I paid for it. I'm not getting any affiliate, nothing from this. This is just something I wanted to do. So I've already spun the wheel. We've got our three winners. And so now the final recap. Look at everything we've covered with the little letter E. We started with E for eating, pay attention to changes, protect dignity, encourage appropriately, know the difference between a change that needs to be reported and an emergency requiring immediate assistance, and communicate the concerns to the appropriate healthcare professional. That's serious. I know we had some fun here, but this is serious stuff we're talking about. So then we moved to the emergency preparedness caregiver bag. We talked about medication information. We talked about emergency contacts. We talked about medical and assistive equipment. We talked about backup power needs and a generator, personal care, food and hydration, communication, comfort, and most importantly, the individual needs of the person who depends on us. Caregiving isn't predicting everything that possibly could happen. It's about thinking ahead, you guys. We don't have to prepare for everything tonight, but you can take one step tonight. Write that medication list down. Write down the emergency contacts. Talk with your family. Ask questions. Start with your caregiver bag. Consider getting first aid and CPR training. One small step leads to another and another. And before you know it, you've started building a plan. So and I just want to read one final disclaimer, you guys. Before we close, I want to leave you with one final reminder. This program is for general education and informational purposes only. The information shared here is not individualized medical, nursing, nutritional, emergency management, legal, or other professional advice, and should not be used as a substitute for a professional evaluation, certified hands-on skill training, or individualized recommendations. Every person's medical conditions, medications, dietary requirements, swallowing abilities, mobility, medical equipment, and emergency needs are different. So always follow the individual's established plan of care and recommendations from their physician's, pharmacist, registered dietitian, speech language pathologist, medical equipment provider, or qualified professional as applicable. CPR and first aid information presented is for awareness and education and does not replace an appropriate hands-on certification course or current emergency response instructions. For emergency preparedness, follow current recommendations from FEMA, ready.gov, local emergency management authorities, and emergency responders. If you believe that someone is experiencing a medical emergency, call 911 immediately. During an emergency, life safety comes first. Never delay getting yourself or another person to safety in order to retrieve an emergency bag. People first. This presentation does not guarantee safety and does not replace individualized emergency plans. Tomorrow, we will discuss F for falling. The CDC reports that about 3 million emergency department visits, roughly 1 million 1 million hospitalizations every year from older adults from falling. Thank you so much for joining me for the ABCs of Caregiving, Caregiving Made Simple. Take care of yourself. Take care of the people that you love. Keep planting those seeds. And remember, a mustard seed is all I need. Thank you guys so much. Thank you so much. And don't forget, check the expiration dates on anything that you put in that to-go bag. Thank you. Thank you. Thank you. You guys loved on me tonight, and I appreciate it. Inbox me your information, and I will make sure that you get, if you want a first aid kit, you'll get that. If you want some cash, I'll send you that. But we've got three winners: Hill, Nandy, and Brandon. Thank you so much. Bye bye.